Hello, my name is Tess Carswell. I'm a PhD student at the University of Victoria in the Department of Mechanical Engineering. And today I'll be giving a presentation on behalf of our team members titled A Patient-Oriented Research Approach to Studying Sex and Gender Differences in the Prosthetic Needs and Priorities of Lower Limb Amputees. Our team members have no disclosures to discuss. To begin, I would like to introduce our team members. There's myself, Julia Chisholm, a patient partner and co-author of this presentation, Josh Giles, a researcher and co-author, Al Hall, a patient partner, Helen Monkman, a researcher and co-author, Jessica Nathan, a patient partner, Diane Reed, a patient partner and co-author, and G. Timmer, a patient partner. Significant research efforts have targeted prosthesis design for lower limb amputees. And there's a lot of research in this field, but the vast majority of subjects in this research are male, despite females accounting for around 30% of the population. And if you were to do a quick Google search and use keywords like amputee stock photo or lower limb amputee stock photo, you would get a similar screen capture as this, where if you scan through, you'll see that the majority of the representation is male. We do see there are some gender neutral representations, but on closer look, there are only 3 concretely female representations. And if you look closer, you'll see there are around 13% female, 60% male, and 26% that are gender neutral or can't be discerned. Looking back into the literature now, female lower limb amputees experience different risk factors than males that can impact success with their prosthetics, including greater dissatisfaction, higher rejection rates, lower success with fit with their prostheses. And despite these differences being a common finding in literature, there is no consistent reasoning presented. And so studying sex and gender differences in the lower limb amputee prosthetic priorities can provide a better understanding for this discontent and help guide optimization of a female-specific prosthetic. Therefore, the purpose of this study was to take a patient-oriented research approach to better understand sex and gender differences in LLA prosthetic priorities. Now I'd like to discuss the methods of our patient-oriented research. The plan was to develop a patient partner advisory committee, where the committee would meet monthly to collaborate on all aspects of the research, including research questions, the development of study materials, interpretation of results, and dissemination of findings. We worked with ReachBC, local clinicians, and certified prosthetists to connect with female partners of different ages, backgrounds, and experiences. And from this, a patient partner committee was developed, consisting of 5 female lower limb amputee patient partners, 2 researchers, and 1 volunteer, where our partners range in age from their 30s to their 70s and have different careers. We have someone, a medical doctor, an accountant, kinesiologist, as well as different amputation levels. And by engaging partners of different age, background, and experience, this ensured that a diverse range of perspectives could be shared, adding immense relevance and value to the research. Early meetings involved meeting the team and giving an overview of the partnership and the project. These photos here are a snippet of an orientation package provided to partners, meaning to introduce ourselves to the team. From there, monthly meetings started from March through to August 2021. In early meetings, questions were asked to better understand a patient's desired outcomes in the partnership, including what interested you in this research, what drew you to it? How would you like to be engaged and participate in this project? There were discussions of compensation options, as well as discussions of the specific influence their collaboration would have on the research. And from these early meetings, there were themes coming out, including trade-offs seen with prosthetics. There are trade-offs between function and cosmetics in prosthetics, as well as lack of female representation. There's a lack of opportunities and representation for female amputees in what to look like, and difficulty connecting with others. I'm missing that peer connection with female amputees who have similar interests and challenges as me. From there, meetings evolved to collaborate on research questions and the development of study materials. Where study materials here are those for a specific research study that I will discuss for the rest of the presentation, including a survey and interview questions. For the survey, we started with what's called the Prosthesis Evaluation Questionnaire, and this is the most frequently used questionnaire in prosthetics research. It consists of 82 closed questions on a 10-point ordinal scale, with 9 validated independent subscales and additional questions, where these subscales are commonly used independently of each other. And considering the history of amputee and prosthetics research, as well as discussing with patient partners, it was believed that the PEQ may not adequately capture perspectives of female lower limb amputees. Therefore, the PEQ was adapted based on guided discussions with the partners to better capture female priorities. And in doing so, 7 of the validated subscales were kept as is. Other scales were adjusted or removed in consultation with partners, and sex and gender-related questions were added, among others, to target key priorities of the partners. From there, drafts of this new survey were further adjusted based on feedback from partners that took the survey as testers to give an idea on the length and clarity of questions. For the interview, open-ended questions from this new survey were considered and discussed in meetings with partners for inclusion in the interview. The wording of these questions were adjusted based on deemed clarity from partners, and the list of questions was further narrowed to fit into a desired time slot. Now discussing methods of the research study. Ethics approval was obtained in October 2021, and the study is ongoing. Participants in the study will complete the newly developed survey online with the option to then also do a follow-up interview on Zoom. We've received recruitment help from local CPs, patient partners, and ReachBC. And for the research study, we aim to recruit 20 female lower limb amputees and 20 male lower limb amputees, with inclusion criteria including having a single limb lower limb amputation and a K level of 2 or higher, where a K level is a mobility index, and a level of 2 or higher indicates that the participant is able to get around their community and their household using their prosthesis. With exclusion criteria, including having been medically diagnosed with severe depression, as well as having an osseo-integrated prosthetic implant, which means that their implant is integrated into their bone. As I mentioned, the study is ongoing, so once results are accumulated, they will be analyzed by researchers and patient partners to assess differences between groups. Next, to discuss the results of our patient-oriented research. So these study materials were developed through collaboration with our patient partners to ultimately create a 100-question survey and a set of 8 interview questions, where the survey sections include a demographics section, main content, and follow-up questions. Some examples of main content survey questions include, over the past 4 weeks, rate your ability to walk when using your prosthesis. What are your top 3 priorities regarding your prosthesis? Please rank them. Examples of interview questions include, how much has your amputation affected your interest in having children? Do you feel as if your masculinity, femininity has been affected since your amputation? If so, how? And these materials were successfully developed in that partners believe they accurately represent the relevant interests, priorities, and perspectives of female lower limb amputees. Partnerships developed with patients were also successful, and I have some direct quotes here. Thanks for the opportunity to continue to work with you on the project. I am very impressed with the work you have done on this subject. I would like to continue with this project as I am learning more tips about my situation from others. The conversations have been enlightening. I really like talking with others who understand and live the reality of losing limbs. Thank you for the opportunity to be in the group. As mentioned, the research study is ongoing, so results will likely be available by April 2022. This study is part of a larger project aiming to guide optimization of a female-specific prosthetic. And a critical aspect of early-stage medical device research and design is consulting with patients and users to understand their needs and priorities for a medical device. And these needs can then guide aspects of device design to ultimately offer a safer and more effective device. And doing so is particularly important when considering a population and user base that has been previously neglected in research, like female amputees. And so taking a POR approach to this study and collaborating with patient partners was crucial. The committee's work has been and will continue to be invaluable as we are developing research that is more relevant to female lower limb amputees. There are some limitations to this research study. The survey and interview developed are not validated tools. Due to the exploratory nature of the study, we believed it more important to ask the most relevant questions to our objective, rather than using standardized tools for validity. As well, validated scales from the PEQ were kept as is and can still be compared to results from other studies. Some of our patient partners may also be participants in the research study. So due to difficulties with recruitment, this became necessary, and such responses will be monitored for any biases. For our dissemination plan, our work with partners will continue as we interpret results and help disseminate findings. These findings will be presented to local CPs and clinicians that have been consulted with throughout the work. And our participants in the research study also have the opportunity to be followed up with about findings and can thus help further disseminate knowledge. In conclusion, a POR approach was taken to study sex and gender differences in the prosthetic priorities of lower limb amputees. A patient partner committee was formed to collaborate on the research project and the development of survey and interview questions. These study materials were successfully developed and that they target key perspectives of our partners. And future work will involve analysis and interpretation of study results with our partners, along with dissemination of findings. I'd like to acknowledge that this research was funded by the University of Victoria, the BC Support Unit, and the Government of British Columbia. A special thanks are given to our 3 other partners not listed as co-authors of this presentation, including Elle Hall, Jessica Nathan, and G. Timmer. Here are my references, and I would like to thank you for your listening, and I'm happy to answer any questions.